Imagine a condition that affects more people than the entire population of Italy, yet most of us dismiss it as just a skin thing. Today, we're exploring how deeply wrong that assumption is. Hi, everyone, and welcome back to Health Talks Weekly. I'm your host, Sarah, and today we're diving into the truth about psoriasis, an often misunderstood and stigmatized condition that goes far beyond skin. Joining me is Will, a health researcher and advocate who's been exploring this topic in depth. Will, thanks for being here.
Thanks for having me, Sarah. I'm really glad we're talking about this. It's such an overlooked condition, yet it affects millions globally.
Let's start with the basics. What exactly is psoriasis?
Sure, psoriasis is a chronic autoimmune condition. Basically, the immune system gets confused and starts speeding up the skin cell cycle, causing red, scaly plaques on the skin. But it's not just cosmetic. It can be painful, itchy, and emotionally draining.
And it's more common than people might think, right?
Definitely. Around 125 million people worldwide live with psoriasis. That's about 2 to 3% of the global population.
And yet, so many still believe it's just a rash or that it's contagious, which it absolutely isn't.
Exactly. That kind of misinformation feeds stigma and isolation.
Let's talk about that stigma. What are some of the real world challenges people face?
So many. People with psoriasis often experience staring, unsolicited advice, even outright discrimination. Some avoid swimming pools, summer clothes, or public spaces because of how others react to their skin.
I imagine that wears you down over time.
It does. It's not just physical discomfort, it's emotional. Many people report depression, anxiety, and a drop in self-esteem. One study even showed that people with psoriasis have a significantly higher risk of suicidal thoughts. It's serious.
That's heartbreaking, and it shows how misunderstood this condition really is. Now, you've mentioned before that psoriasis isn't just a skin condition. Can you explain that?
Yes, and this is so important. Around 30% of people with psoriasis also develop psoriatic arthritis, which causes joint pain, stiffness, and swelling. Left untreated, it can be disabling.
That's something most people don't associate with psoriasis at all.
Exactly. And the risks go even further. Psoriasis is linked with heart disease, diabetes, inflammatory bowel disease, and even mental health disorders. It's a systemic condition, not just a patch on your elbow.
And there's been a global push to change how we view psoriasis, right?
Yes. In 2014, the World Health Organization released a global report on psoriasis, highlighting its global burden. Then in 2016, WHO passed a resolution urging countries to improve access to care, fight stigma, and recognize psoriasis as a serious noncommunicable disease.
Has that made a difference?
It laid the groundwork. Some countries have taken steps, like expanding dermatology services or increasing funding for biologics. But progress is uneven. People in lower-income areas still face long wait times, high costs, or complete lack of access to care.
Let's bring this back to the human level. What are some stories that have stuck with you?
One woman I spoke with said she hadn't worn a sleeveless shirt in 10 years. Not because she didn't want to, but because of the comments she'd get. Another person said, "I'm not brave. I'm just tired of hiding." That says it all.
It really does. And despite all that, people go on living their lives, working, raising families, and managing flares day by day.
Absolutely. The resilience of the psoriasis community is incredible, but it shouldn't be this hard.
So, what needs to happen to really improve life for people with psoriasis?
More awareness, more empathy, and better healthcare access. Healthcare providers need training to spot psoriasis early and treat it holistically. Public conversations like this one can also help end stigma.
And for listeners who might not have psoriasis, what can they do?
Be kind. Don't stare or make assumptions. Learn. Share content from trusted sources like the IFPA, the International Federation of Psoriasis Associations. And speak up if you hear someone spreading myths. Also, there's a fairly new YouTube channel, Psoriasis More Than Skin Deep. There you will find videos about psoriasis, treatments, and much more. Go over and drop a like and subscribe. It costs nothing but can mean a lot.
Will, thank you so much for shedding light on this today. This has been eye-opening and, frankly, overdue.
Thanks, Sarah, for inviting me on. It means a lot to have platforms like this spotlighting conditions that are so often ignored.
To our listeners, if you or someone you know lives with psoriasis, know this: you are not alone. You are seen, and your story matters. Let's keep the conversation going. Share this episode, check out resources at ifpa-pso.com and psoriasis. More than skin deep, and join us in spreading real awareness this August during Psoriasis Awareness Month. I'm Sarah,
And I'm Will.
and this was Health Talks Weekly. See you next time.